Most families aren't choosing between luxury care and no care. They're stuck in the middle with no real options. My hot take this week, Medicare is not your golden buzzer. If I got a penny for every time I had a patient or a family tell me that they were fine because they have Medicare, I think I might make a lot more money. The forgotten middle is wildly misrepresented in elder care. Medicare only covers 80% of your healthcare bills, and the other 20% you either opt into a secondary or supplementary insurance to cover that, or you pay out of pocket. And what are the options? Well, that depends on your income. Below the poverty line, usually eligible for state-level Medicaid. I say usually because it depends on your state what that income eligibility is. And the alternative is a supplementary insurance plan that you pay an additional monthly premium for, so 2 premiums a month. Or you pay out of pocket, which can add up pretty quickly, 20% at a time. So what's the option for someone who's too poor to pay out of pocket or pay another premium, but also makes just a tad bit over the poverty line and isn't eligible for Medicaid? Well, that's the problem. There isn't one. Welcome to the Aging Together podcast. I'm your host, Dr. Pooja A, Patel, a double board certified occupational therapist and gerontologist with additional certifications in dementia and fall prevention. This season, we are unfiltered. In this podcast, I interview guests who are experts in their fields or caregivers who are sharing their lived experiences. Let's meet today's guest. This week, we're talking about the forgotten middle, especially when it comes to aging in place and elder care. Who falls into this category? Why does our system consistently fail these people who don't qualify for help, but clearly need the support? And what can we do about this? To help tackle this topic, I'm joined by Dr. Brandy Archie. Dr. Archie is an occupational therapist certified in living in space and is the founder of Ask Sammy, a digital platform designed to make daily living safer, easier, and more affordable for older adults and people with disabilities. With over 17 years of experience in home health and elder-focused care, Dr. Archie built Ask Sammy to bridge the gap between clinical guidance and real-world solutions by combining AI-powered recommendations, adaptive equipment, and virtual OT support. Her work is grounded in the belief that accessibility should be a right, not a privilege. Dr. Brandy, thank you so much for joining me today.
Thanks for having me. You teed up this conversation so well, because it clearly defines it for everybody. I don't think there's anybody who's listening right now who can't be like, oh yeah, that's me or somebody I know. So thank you.
Yeah, when I thought of this topic, because I was just getting so frustrated with all of these people in the middle who are like, what do I do? And then I was thinking about it and I was like, I know just the right person who can probably talk about this. So what's your hot take on this topic?
So my hot take is that not only is everything that you said in your hot take true, but also most of the innovation that is occurring right now, those people who are starting that don't even recognize what the forgotten middle is. And so even though there's lots of digital health startups and lots of new things coming out, and everybody talks about how healthcare is broken and that there's all these innovations to try to fix it, I have found that in this world, especially in the tech space, these companies are not seeing the forgotten middle either. And so they're either focused directly towards serving a Medicaid population in a particular way, not that they don't need innovation to, they totally do, or serving a population that has a fair amount of money to cover their services that they haven't going on, or the way you structure your tool really tells you who you're trying to go after. And there's not a lot of innovation happening in this gray middle space of things that aren't necessarily covered by insurance, but kind of feel like they should and can't really afford it because you're on a fixed income, but you also don't qualify for help. And so I think there's a huge hole there, and we're not moving fast enough towards filling it.
You're so correct in that. I've noticed more and more of these tech companies focusing on either end of that continuum, and there's so little. And yes, we need, like you said, we need innovation on both ends, but the middle really needs it, and nobody's focusing on it. And then what happens is that us as providers are left to fend for ourselves in order to help these families and these clients get the care and the resources and the support that they need. Can't always find it.
Exactly. And in addition to that, the majority of the people actually do fall in the middle, right? It's it's not nothing. We're talking about millions of people across this whole spectrum, right? And it's a fraction of the people who actually qualify for Medicaid, because to qualify for Medicaid, you really do have to have basically nothing. And there's a fraction over here at the top end who can afford the care that they need. They just need better access to getting it and understanding what they need to get, right? But the majority of our seniors are in this middle spot, and we're not innovating for them. Or I should say, not enough people are innovating for them. And that's the word that gets out. And they don't even half like times recognize that they need that help until the last minute because they think that Medicare is going to cover everything.
Yeah, I think there's a multiple issues here, right? There's a health literacy piece of it where they don't understand what they need until maybe it's too late. And they don't understand that these resources are potentially available to them because they're just not aware of it. And the other part is generationally, usually in these populations, right? They've cared for each other in the family. They haven't ever outsourced something like that. And so they think it's just part of their day-to-day. It's part of their life. There's nothing that they can do about it. And so regardless of whether they can support them or not, physically, mentally, financially, they're going to do it. And so it becomes this kind of not really a catch-22, but kind of like this vicious cycle of they don't know that they need it, so they don't look for it. But even if they were to look for it, anything that they would find, they wouldn't be able to afford it. So then they just don't look for it. It just becomes this cycle. And so then they're just like, well, screw it. I'm not going to look for this. No one's out there to help me. And they're not wrong.
They're not 100% wrong. Sammy is out there to help them. That is exactly what we're trying to build.
Yes, it is.
So we can't say nobody and nothing, but there's definitely not enough. And I also would say that, like, in that cycle, what happens after that is that person struggles, gets a little help from the family, does the best they can. At the same time, their life shrinks, right? Like if I feel unsteady and unstable, I'm not going to feel like I'm going to go out and go bowling or go do extra stuff I don't have to do. And so what ends up happening is that life gets smaller. We're only going to the doctor's office or to big events like to see grandkids or whatever. And therefore, we're not moving more. And everything that was probably causing some trouble is getting worse because we're not engaging in life as much as we used to. And so that's a vicious cycle too. And that is exactly the scenario that ends up showing up in the hospital and now needing acute level care because we've had a fall and a fracture, or because we've gotten a ton of swelling in our feet and our CHF is not managed well because we're not moving very well, or our diabetes has gotten out of control. And, all of these chronic conditions that this innovation around is here for. I think we don't connect the dots all the way back to like where the intervention could be happening to prevent this cycle from happening in the first place. And the solutions don't actually have to be expensive, especially if you start early. But if you're not, like to your point, if you're not looking for help, you don't know, you only do the best that you can do, right? You only know what you know, and you only do the best that you can do. And sometimes that's just not enough. And over time, it gets worse. And now it is a big problem.
Yeah, definitely. You mentioned Ask Sammy, of course, which you started because of this issue, right? With a lot of difficulty with families being able to access the care that they need. And then for us as providers being able to find them the care and support that could be available to them. I know right now in my work, a lot of times what I'm doing is I'm probably doing a Google search just like they would be, but I just know what to search for and can maybe do it a little faster. But even then, I'm going between a bunch of different resources. I'm looking at different agencies, different organizations, pulling different pieces of resources, and then compiling all that and saying, here. And it's a process and it is hard, but then now I've added all of this extra work to their plate and said, hey, here's a list of like 10 or 15 things that might be able to better support you. You're going to have to go through this and figure out what, maybe talk to every single one of them and figure out what they can each offer you. Yes, we have also the next phase of support with care managers and things like that, where they can do that work for you too. They charge by the 15-minute increment like a lawyer. So again, the people who can afford that, great. But the people who can't they have even more work on their plate to try and sift through all of this information to find out what might actually work for their families. Or they're sitting there making call after call, waiting to talk to somebody on the phone, and they're spending an entire day just on the phone trying to figure out what could potentially help them.
Yeah.
So what did you do? Or I guess tell us a little bit about like how you've tried to and continue to try to meet that gap through Ask Sammy.
Got it. Okay, so in my work as an occupational therapist, I was doing the exact same thing as you, Pooja, and that is like spending time essentially outside of my typical work time because it wasn't really my job, but you can't unsee a problem. I can't unsee a problem. Let's say that. And you know that there's something out there, but you just don't have your finger on it. So you go looking and then you try to give them what they need. And that took a lot of time from me. And it also, every way I tried to make it easier was just not sufficient enough. Like I tried making these handouts that had links on them or pictures or addresses to the places close by that had the stuff that I was recommending. And as soon as I printed that thing out, it was obsolete, right? And so even if somebody actually went over there, they're like, oh, that Walgreens didn't have that, or oh, that CVS didn't have that. And so this felt like a really big problem that I saw everywhere that I worked, because I worked all over the country and in a bunch of different settings. So it felt like a big enough problem that needed to try to have like a bigger solution. And so what we did is use technology to help us. And, this a benefit to be around at this day and age when AI can help to organize and have us access information as long as we give it good info. And so our priority is to give it good info. So Sammy is an AI tool. And so instead of having to call a particular service provider and ask to see if you qualify or if this is the right service for you, like we've got all that information into the back end basically, and you just talk about what your problem is. And Sammy tells you like, hey, I think you benefit from this adaptive equipment or this resource or this service. And here you go. We're getting you as close as possible to completion, right? You can purchase the adaptive equipment from us, or we'll get you a link right to the service and they're connected with us. We've already vetted them. Or there's a resource that tells you step by step how to do a thing. And while there's still work involved because like all this is probably new and there's change and change always feels like work, we're trying to get you as close to the finish line as possible so that all you have to do is just step over it.
That's really interesting. Is that publicly available or is it usually used as like a resource by other providers who then share it with their clients?
Both. It's about 50-50. So half the people are coming there on their own because they're searching for answers in Google and our answers are showing up. And half of them are being referred by clinicians or service providers of all kinds, I should say, not just occupational therapists, but case managers and lots of people that we've interacted with in the healthcare ecosystem. They're using it to find the answers and then sharing directly and like, hey, you should go here to find the answer to this information.
Got it. That's super helpful. I want to go back to something you said earlier, and that was about how we often, as full-time clinicians, when we're working in the systems that we work in, we will often try to find resources for our clients outside of our time with them. And I just want people who are not in the industry to understand we don't get paid for that. Like, no. You cannot... Like, we will literally sit there sometimes, like you said, we can't unsee a problem once we've identified it. And if there's nobody else there to be able to provide some sort of solution to it, we're going to try to do that. And that means we're doing it on our time because there's not a system in place unless you work for yourself where you can bill for that and get paid to do that. So if most of your providers or if any of your providers for the people listening are taking the time to find resources and support for you, just know that they're not getting paid to do that unless they're working for themselves, in which case I'll wrap it into my billing fee, right? Mm-hmm. Or my consult fee or whatever it is. But I just think that that's so important to know because that also is a big part of where this forgotten middle doesn't get access to this level of care, right? I have my own consulting practice, and this is essentially what I do is I help connect families to resources. But a big part of that is I charge by the hour. It's just an hourly rate, right? It's not a service that's covered by Medicare or by health insurance in general, because it's educational and it's consultative. And so I can charge for the time that I think it'll take me to put some resources together for you. The reason why I keep it such a realistic and reasonable rate is so that people can have access to me. But then I have people on the lower end of it where they're reaching out and they're like, I can't afford this. And then I have people on the higher end who are like, not even blinking an eye. They're like, oh yeah, can I talk to you every week? And I'm like, that's insane. We try to find or create resources to support this middle class that's not middle class from a financial standpoint, but middle level population here that doesn't have access to these resources. We try to create something for them, but then they're the ones who can't access it because it's too expensive. But we also have to make a living. So how do we do that?
I think that's where you have to put tech into it, because while I 100% appreciate a one-on-one connection with clients, that's why I became a therapist. So I didn't come a therapist to be sitting behind a computer screen, right? I like working with people, but that one-to-one time is fairly expensive. In order to scale up our OT expertise, we have to replicate ourselves in some form or fashion with technology. And so the way we approached it was like, if I can make the AI tool free for you to access, and you can get some information that's pretty specific to your needs, that can be your free access point. If you feel like this isn't specific enough to my unique situation because I didn't talk to a person or what have you, then we're going to give you access to maybe a virtual occupational therapist, which is more affordable because they don't have to drive to your house and it often takes less time, and you can book it right there, trying to get you close to the finish line. But then if you have the means or have insurance that connects with the OTs in your area, then we're trying to connect you with an occupational therapist so you can get that one-to-one care, whether it's via insurance. If their practice takes insurance, then great. If their practice does not, because they're doing it in a different way, then great. We're giving you the opportunity to connect with them so you can pay for it. So no matter what part of the income stratification you're at, we're trying to give you some solutions that can be helpful. And because I think one of the hardest things about finding resources for people is that you have to self-select into them based on what you can afford. They're not all in one place. So it's like, here's these things for people on Medicaid. Okay. Here's these things that cost this much. Okay. But they don't live together. It's not like I could just be like, hey, Mr. Smith, you should just call this number or go to this website and they'll have something for you. I have to be like, I think Mr. Smith is on Medicaid, so I think I got to filter that down. This thing over here probably takes them, are they in the right state? I live on a state line. So like, this service is the Kansas side, this doesn't. This service is on the Missouri side. I got to filter that. And then I'm like, okay, this is the resource for Mr. Smith. That stuff takes time and also a lot of experience and knowledge. And like, what if you just happen to run into somebody who, one, doesn't have the time, because like you said, it's outside of our normal time, or two, just hasn't had that problem happen before, so they don't have the experience, so they don't have all that catalog. They're not trying to do a bad job, they just don't know. And like, why should we live in this day and age? Why should access to information be a barrier? That's how I feel about it. I think we should be able to access the information. If you want more help and hand-holding and more guidance, you need to be able to cover that service in some way. But at least getting good information, you should be able to get good information that you can trust pretty easily. And so that's what our goal is to try to make it so that we can democratize access to good clinical information, so you at least are not left with nothing and just struggling. Because the number of people I have seen who've been struggling for years, maybe doing a thing a certain kind of way or not doing a thing, and I walk in and I'd be like, oh, you actually could do this XYZ thing and that will solve this problem. And they'll be like, what? I wish I would have known about that a year ago. And I'm like, I'm sorry, it shouldn't have to take me showing up for you to know that, because I'm not the beholder of all information. It's just you didn't know what to look for, so you didn't know how to go find it, even though it did live out there in the world. And like, that is a travesty to me. We should be able to clean that part up at least.
Well, and that's exactly what I'm talking about when I talk about like literacy in general, right? Like health literacy. Because if you don't know that you need to know something, then you don't know what you're looking for and you don't know where to look for it. And with how much information is available on the internet, you just, especially now, we just don't know what's real and what's not, first of all. And second of all, we don't know what is rooted in true clinical reasoning and sound judgment versus something that a machine put together, right? And so I think there's even more importance now than ever to make sure that the tech we're building is fully supported and trained by clinical professionals and providers, right? So that there's accuracy to that. And then there's an experience component of it that ties into it, just like you said, right? I can tell you after almost a decade of working in a hospital that some equipment is covered by insurance, some isn't. Some is covered by Medicare, some is covered by Medicaid. They don't often overlap. Some is covered by commercial commercial payers, some is not. And like you said, it differs from state to state. And the biggest part of that is that it can change at any time. And so yeah. And if you don't know where to look it up, or if you don't have access to, right, like in all the hospitals I've worked at, I've always had the social work or the case management team that's looking up coverage data, right? And they're trying to figure out, okay, hey, the OT recommended this equipment, the PT recommended this equipment, let's check their insurance, let's see what's covered, what's not covered, and then we get to hear back from them. And then if it's covered, great. If it's not, then we have to think of a plan B if they can't afford it off the marketplace. Like, there's a lot of work that goes into that. And so, one of the parts we wanted to talk about was also how the forgotten middle specifically impacts elder care and aging in place. And I think equipment is a big part of that, right? Because if people want to remain in their homes, medical equipment, assistive devices, adaptive equipment, that's usually the first line of defense, right? Like, we're like, okay, let's set you up with all the safety features. And then if you have more money, you can put in all the bells and whistles and do a full remod. But most people can't do that. Right? And so what do you see as the biggest impact to that within this forgotten middle?
I think it's the knowledge piece, to be honest with you. I think you and I know that we want to set them up with the right equipment, and that can cut a lot of the problems. But I think most people don't realize that. Yeah. And they think, like, I want to stay living here, and I can't step over this tub, so this tub should be turned into a shower. That's logical. You see those ads. I know I see these ads on the TV all the time, right? And so a solution is remodel this bathroom. However, there are multiple barriers. Number one, if you don't own your home, you can't do it, right? Even if you do have money, you can't do it if you don't own your home. If you do own your home, you have to have enough money and time to do it. So if you are just coming home from the hospital after some major life change, you're not going to get a bathroom remodel done before you get home, likely, right? And so you still need a solution in the interim. And then thirdly, I think it's like, who's trusted? Who do you call? Do you know that you should probably find a certified aging in place professional and to do your bathroom remodel, because the details do actually matter? Do you know that? Probably not. And so you just find like whatever contractor you see on TV who usually charges the most money possible, and you do the best you can. And that's the pathway, even though a completely different pathway would be, I'm recognizing challenges, or I want to prevent challenges that might happen to me in the future, and therefore I'm going to get an expert on my case and find an occupational therapist, because all of us are qualified to do that, because that's what we do as occupational therapists. But do people know that? That's a challenge too, right? Like, it's part of what we're trying to do is like bring more volume and voice to the profession so that people know that you can find one in your community who could help you plan this out, so that we could figure out what the next best pathway is going to be for you. Whatever way you engage with an OT, wherever you find them at, this is still like super valuable to find an OT and have them help you figure out what should be done next. Because when we actually get to plan something, then we can save money, we save time, and we actually get what we need in a way that's like coordinated and thoughtful about your particular daily activities, because everybody's life looks different. So I think that's the biggest challenge point, the biggest impact for people in that middle spot is the access to the information to know, like, let's choose pathway B instead of pathway A, because it gives you more options.
Yeah. And I think you mentioned, like, the big part there is knowing that we exist, right? I always say this, yes, a lot more people know what OT is today than they did when I first went into OT school over a decade ago, right? But that being said, people still don't know what OT does unless they've had some sort of experience with it in some capacity, right? And a lot of times it's because, like, so-and-so had their kid in OT, or so-and-so saw OT after their hand surgery. And so they've had these very specific encounters with OT that they don't know the full breadth of the work that we do. And so they don't know to look for us. And then when you talk about finding certified aging in place specialists and home modification specialists, it's so hard because a lot of these contractors also have some of these certifications, right? And so then it's like, okay, cool. They can probably help you figure out safety needs and things like that. But are they going to be tailored to your needs? You have a right hemiplegic arm because you had a stroke, but your partner, your spouse, has a left armed effect, and how are we going to plan this to be able to support both of you in the long term, right? That's the difference in having, I get into this little rant too, and we have another session coming up on how home modifications aren't a weekend project, like you said. But, you start getting up these ADA universally designed products that are not actually designed for anyone specifically. And so then it doesn't work for anybody. And so what do you do about that is plan ahead and get the right people in your circle and see how they can help you minimize your cost and maximize your safety.
Because the thing that's the worst to me, like the lack of access to information, is a travesty. However, the worst thing is that you figure out a way to gin up the money and you buy some stuff and it don't work for you. It's not because the product is not correct or broken, but like it just like you thought it was going to solve this problem and it didn't solve the problem. And the number of garages I have seen and basements with like perfectly good equipment sitting in there collecting dust that somebody spent money on and still having the problem in the house, whatever that problem is, because somebody got them a shower chair and it's not adjustable and it's too low for them to get up from, or this grab bar that doesn't actually work or attach to the wall in the right place. I don't have any studs. Like, they're just power chairs, power wheelchairs that should be providing you significant amount of mobility and cost tens of thousands of dollars. Maybe not to you because insurance does cover power wheelchairs, but it costs a lot of money and didn't get spec'd out exactly right for their needs, or they got overwhelmed with how it works and didn't ever use it and now are still falling because they're trying to walk from place to place and it's already been proven that they need a power wheelchair. That thing to me is really challenging because you actually did find a way to get access, but then you didn't get the right thing, and that's the worst, right? Because now you both out of the money and still don't have a solution to the problem. And so that's why I think it's so, I'm such a broken record, but I'm just always saying, like, you need to get an OT involved. Don't do nothing until you have an OT involved, because we're the ones thinking about exactly what you just got done saying. The whole lifespan, everybody involved in the home, everything involved in your care, what might happen in the future. Maybe we have a progressive disease. We're doing okay right now. We're not thinking about now. I'm thinking about down the road. So you don't never have to do none of these changes again because we already thought about that in advance, right? And you can't work out every problem in advance because you don't know everything. But if we can deal with 80 to 90% of it just off of experience as a clinician and having that brain power to be able to apply what we learn as clinicians and to your life specifically, it's just such a lifesaver. And when you only have so many resources to work with, we should use them really wisely.
I agree. I couldn't have said that better. I think, yeah. If you don't involve an OT, you're going to get a bunch of stuff that is not tailored to you, and you're not going to be very happy about it. I always, when I get asked to do like a home safety assessment or like just general recommendations for aging in place or home safety, my first like very morbid question is like, do you plan to die in this house? Because I think people just don't think about it that way. They're just like, oh yeah, like I just want to make it safer right now. But they're like 50 something years old or 60 something years old. And then I'm like, is this your forever home? Like, do you plan on dying here? Because if that's the case, you don't know when you're going to die unless you have some terminal illness or you're on hospice or there's like a specific time frame that we're looking at. But most people have no idea how long that's going to be. And if we're planning for it in your 60s or 70s and you end up living into your 90s and 100s, which a lot of people are now, then
yes,
I'm sorry, we need to think about, what if you fall and break a hip? What if you end up getting dementia? What if you end up with having a stroke and then you're hemiparetic? There are so many things, like what ifs, that you have to plan for. And if you don't have the right clinical expertise in the room, you're not going to know how to plan for that. And that is why you have to have everyone in the team, especially if budget is tight and you don't want to spend your money in the wrong spot.
Totally. I mean, and I'm sure that probably sounds like very overwhelming and paralyzing, and it is, right? Mm-hmm. But also, like, there's a whole, profession set up to help you deal with that. And right. Starting with the plan makes all the difference, Even to the point of, like, maybe this is not my forever home and I want to move. Great. Let's talk about what you should look for in the next place that you live in. Because then maybe you don't got to do hardly any changes at all because you've self-selected into a more accessible home that you can age in place in well, right? Like, my house, when we first pulled up to it, when we were looking for a new home, I was like, oh yeah, this is definitely, we could die in this house. I literally said that. And my husband was like, what? I'm like, oh, there's only one step to get in here. There's a bedroom on the first floor. Somebody already put grab bars in the shower. This is great. Like, we don't have to spend hardly no money to change
that
this
sounds
if
great.
we were in a wheelchair. I mean,
yeah.
But it still looks beautiful, and it's still a nice house, and it doesn't look like it's made for somebody who's trying to live in a hospital.
Yeah.
But there's these key things that, as an experienced person, I'm looking for, and I know that, like, even though it's not technically wheelchair accessible home, it wouldn't take much to get it there, and we could do it very quickly. And so that's okay too, because then you know, right? Like, you know, like, if this thing happens, I have a plan. And that's the rest assured aging in place plan, right? That's the thing that you can do in the forgotten middle, because maybe you can access a loan. Maybe you can get money from friends and family if you've already had a plan that, like, oh man, the thing that I didn't want to happen did happen. But I know that if I can just get this amount of dollars, I can get a stair lift put in here, and everything I need is upstairs. And I've thought about that, and I know that a stair lift costs $3,000 to $4,000, right? Most people don't even know that, right? And so, like, I know how I can access that money and get that thing going. You know what I mean? And so having the knowledge, again, is like the key thing to, like, have a plan and have some knowledge so that you can enact it when you need to.
Yeah. Also knowing that there are community organizations that do nonprofit work in this space. And unfortunately, because most people wait until there's a crisis, there's always a wait list at these places. And so if you plan ahead for it, then it gives you time to maybe get on that wait list so that by the time you get it, you'll have access to it. And so I think a lot of what we touched on is just like, one, knowing the information, and then two, planning ahead for it so that you can have access to the stuff that you need without having to rely on significant amount of money or Medicaid because you don't have access to either.
Exactly. And yeah, that's one thing that I'm always saying too, is like, there sometimes are things that are set up for people who are in the middle range and, like, they could qualify for, and you don't have to be completely at the Medicaid level to get it, but they have wait lists, and that's no longer a solution for you if you're trying to do this on the way out of the door of the hospital. But it is a solution for you if right now you see that it's challenging to get in your front door, or that you are using a wheelchair inside the house to move around, but you have to struggle with two people help you out the house because you got a couple stairs and no ramp. You know, there's good amount of not-for-profits that help build ramps, but you gotta plan ahead, you know? And so just knowing that is important. One of the things that we plugged into Ask Savings that I thought was really important is a little widget that helps you find the community resources based on your zip code. And so, because that's ever changing too, and to, like, have a whole log of that is challenging in your brain, even as a clinician, especially if you get somebody in your purview who lives outside of your typical area where you work at. You might not be familiar with their programs, but that way you can, like, just type your zip code in and check it out and see what's around and might be available, and then, like, start the process. Because if you can do it in advance, then maybe we even prevent the fall in the first place. Maybe we prevent the shrinking of our life in the first place. And that's an even better use of their efforts in those not-for-profit spaces.
Yeah, absolutely. And I think you also built out a directory of OT, so people can find an OT in their area. We've talked so much about saying you need an OT on your team, but then they don't know where to find one. So there are a few directories online where you can search for an OT near you. Ask Sammy is one of them. And then an OT is required to be licensed in every state that they practice in. So if you are tech savvy enough, you can go to your state licensure list and actually look up the registry there as well. In most states, I think. I know in Illinois we can. If I just search up occupational therapy, I can see all the licensed therapists in the state. So that might vary from state to state as well. But I think everyone's like, well, great, where do I find one?
Yeah, I mean, I do think that that's, like, a challenge point, which is why we've been building out this network of occupational therapists. So far, at this point of our recording, you'll just find a handful on our website, but we actually have a whole list of 500 OTs that have joined our network, and we're just in the development process to get them showing up live for you publicly. So if you don't see somebody in your area, or you're not interested in a virtual assessment, you can just message us and we will get you in contact with somebody. The The license boards are challenging by state because, like, for example, in our state, you need to know their number or their name in order to get it to show up, and they won't just get you a whole list. But there are a lot of ways to find an expert OT in your particular area, whether that's pelvic floor health or home assessments and home modifications or aging in place or low vision. Like, we are great generalists as overall as clinicians, but we also specialize in a ton of areas that impact older adults and everybody across the lifespan. And we all have that same whole person lens. That's part of the way we're trained to be. And so that's why it's always helpful to have an OT. So definitely please come to Ask the MD, find one, or ask your physician so you can get an order. And that's one way to do it too. So there's lots of ways to access us. The most important part is that you now know that you should be using an OT to help solve your problems.
Yes, definitely. And that is the whole purpose. That's not true. That's not the whole purpose, but that is a big purpose of this podcast in general, is to inform the general public about what you have access to and who you should have on your team as you're navigating aging and care and just trying to live a meaningful life. Brandy, as we wrap up, is there anything you want the audience to take away from this?
I think the biggest thing I'm just going to reiterate that I would want everybody to take away from is that you have access to information and that's clear and qualified, and you should tap into it sooner rather than later. And if you want our help at Ask Sammy, you can get that at asksammy.com for free and find what you need, and we'll help you direct you to the right place.
Amazing. Brandy, thank you so much for coming on. This was such a great conversation, and I am sure our listeners will learn a whole lot from it.
Thanks for having me. It was fun.
Thank you for listening to the Aging Together podcast. If today's conversation helped you, please follow the show, share it with a friend, or leave a quick rating or review. Your support keeps this podcast free, ad light, and growing. Until next time, let's keep learning and aging together. Take care.